time. We all have it, but it never seems to be enough when the clock actually runs out. For some, that's when a new clock starts to race. Now there's a life-saving device that can give the gift of hours, from a heart donor to a new heart owner. Here's Adam Yamaguchi to explain.
Organ transplants are modern medical miracles that have extended life to millions. But the challenge has been the critically narrow time frame to transport vital organs from donors to recipients. Despite quantum leaps in medical biotechnology, the methods used up until recently have been jaw-droppingly basic. I traveled to Andover, Massachusetts to meet cardiac surgeon Dr. Waleed Hassanein, founder of a company called TransMedics, who revolutionized organ transplant therapy with his portable organ care system.
What is the TransMedics OCS?
The organ care system, or OCS, is a device that keeps human organs alive and functioning outside of the human body. So in very simple terms, we replicated human physiology in a medical technology.
So how are human organs currently transported?
Well, historically, human organs were transported literally in an igloo box like this, filled with ice, and the organ is submerged in a preservation solution and moved from the donor to the recipient.
What are the limitations, though?
The longer the organ spends on ice, the organ will die and would never function again. There's no way to assess the organ viability for transplant. And because the organ is just sitting on ice, you cannot even try to improve the organ condition. These are the three major limitations that historically enabled us only to utilize 2 out of every 10 heart and lung donors in this country and around the world.
Dr. Hassanein spent 2 decades working with physicians from multiple disciplines, alongside mechanical and software engineers to develop the organ care system.
So this looks like the first prototype?
That is the first prototype. It didn't need to look pretty, it didn't need to move around, but it needed to make sure that we can keep organs alive.
Once Waleed's team proved the concept, they kept iterating the design to create a proper medical device that was also easily portable, finally earning FDA approval with this.
So now this is the clinical device.
That is the clinical device.
I hear this. I hear something going on. Is there an actual heart in here?
There is a beating heart in here.
Can we take a look?
Absolutely. As you can see, the heart is beating. Perfused with oxygenated blood. And we can monitor pressures, flows, EKG, heart rate, the oxygen saturation, the metabolic condition of the heart, right here.
My heart is racing. This is incredible.
The organ care system has increased the viability of hearts, livers, and lungs for transplant from mere hours to days, improving recipient outcomes and saving lives, which literally touches your heart.